Hi everyone, Scott Nicholson with the Judy Nicholson Kidney Cancer Foundation. I'm back at you with another episode in our patient support speaker series. The Judy Nicholson Kidney Cancer Foundation has loved being able to bring these videos to you, and today we have a very special guest with Jayla Barnes, who is a palliative care nurse practitioner with the Community Palliative Consultants, and they cover palliative care with all hospitals across Jacksonville. So she's here to answer your questions today. If you do have any questions during or after the video, please leave them in the comment section below and we'll be happy to get those answered for you. Now, without any further ado, let me turn the camera around and introduce you to Jayla. Hi Jayla, how are you?
Hi Scott, I'm fine. How are you?
I'm doing great. Thank you so much for joining us today.
Absolutely.
So a lot of people may not be familiar with what palliative care is. Could you please share with us what palliative care is?
Absolutely. So palliative care is it's an approach of medicine that allows patients and families to engage early in serious illness. Not so much just end of life phase, but from the beginning of diagnosis and then carries over throughout their course of the disease. And that can be heart disease, that can be COPD, that can be cancer. It's a myriad of diagnoses that would include.
Awesome. And who in particular is this for? What kind of patient is palliative care for?
Very good question. So any patient dealing with, again, serious illness, not just end-of-life issues, but serious illness. I mentioned before congestive heart failure, COPD. Early in the diagnosis, if patients better understand the disease course itself, the medications associated with it, and they know what to anticipate, it improves their conversations with their physicians and their outcomes as well. So that helps.
How does palliative care impact patient care outcomes?
Good one. So patient care outcomes, patients are better able to participate. A lot of times patients feel they are being dictated to in medicine, I find, when they are ill or have, and I don't mean even hospitalization type ill, but just dealing with complicated medical issues, multiple medications, hypertension that leads to COPD and other ailments. They tend to feel like they're not in control of their care. And so palliative care empowers them to better understand their disease, to be an active member of the medical team, and then to make sure that throughout the course, any changes that go along with that disease progression, they're prepared for and able to continue the discussion with their physician on their management.
How does palliative care benefit physicians and medical professionals? Another
good one. So for the medical community, what I find is when their patients better understand their disease course, they tend to make better decisions about their own management, the things they can control, their diet, their medication compliance. And so as more of a collaborative effort instead of just the physicians dictating the care, I find that there's a lot more compliance. They both have an understanding of what the expectations are and what the goals are because they're defined by both entities or both individuals, as opposed to just being medical profession, driven by the medical profession itself.
I see. So what would you say are advantages to an early engagement of palliative care, perhaps in a hospital setting?
So in a hospital setting, I think I would probably define early engagement in a hospital setting is when some patients tend to get admitted maybe once or twice a year, and maybe there for a few days, could actually go into a few weeks depending on their disease progression, their symptom management needs and all of that. So I think in the hospital, if palliative care is discussed and involved earlier, again, expectations can be clearly defined and discussed and understood, and then if changes are needing to be made to the explanation of care or what the course and direction of the care is, that can be done in the beginning phases versus as the care becomes more critical in later phases. Again, complex medical situations can be a lot less intense when the communication is better and when patients and families feel more engaged and a valued part of the medical team.
And is there any difference in palliative care in a hospital setting as opposed to a clinical or a community setting?
Absolutely. So here in the South, Palliative care is most well known in the hospital setting, which is good. And now the push and the move and the opportunity for improvement and better care management actually has been identified to be most effective if it's engaged a lot sooner, even before patients are hospitalized. Because the patients can better understand their medications, early signs and symptoms of complications or changes in their health or their medical status, and can follow with their community physicians sooner. We find that there's less hospitalization need and less critical phases of the care earlier on. Now, as the disease advances, we expect that some hospitalizations or more critical care may be needed. But in the earlier phases, the sooner the engagement, the better the management and the disease course understanding from the patient and family. So that helps a lot sooner.
I can see how that would help. How can the medical community learn more about palliative care to incorporate it into their practice?
So again, another good question. I love it. So as far as finding out about palliative care in and of itself, there's a lot of information on the internet these days for the medical community specifically to not only identify patients and families that would benefit from palliative care and these conversations earlier in clinical settings and other places, such as CAPC, that's the Center for Advancement of Palliative Care Center. The Center of Advanced Palliative Care, that's CAPC, C-A-P-C. And so you can find a lot of helpful information for medical professionals there. But I think the most important part for them is that if they can engage and understand how it applies and get a comfort level with understanding disease trajectory and then understanding how to have conversations with patients and families, a comfort level with even the difficult pieces. If a therapy is not working well and there are other options or medication adjustments frequently being needed, sometimes can be indications that the disease is advancing, and families may not understand that's what it means. And so to start talking about that sooner at the physician community level helps a whole lot more before patients are more critically ill in the hospital and then needing a lot more intensive management.
Thank you for that. And
Sure.
just to go back to the CAPC, did a quick
CAPC?
search, and CAPC, if anyone's interested in learning more about it, they can go to www.capc.org and find a wealth of
knowledge.
information.
Absolutely, especially the medical community. For patients and families, there's some helpful information there, but it's more geared towards medical management and for the medical community, but still a good website for all.
Now, what's the differences between palliative care and hospice?
A good question. Oftentimes when I'm dealing with patients and families, and sometimes they've heard the word palliative before, and that's one of the first questions I will get is, am I being referred to hospice? And no, that is not the case. Every time you hear the word palliative, does not mean that patient is, and that's good to know for the patient family as well as the medical community. Palliative care in and of itself does not mean an immediate transfer or need for hospice. So hospice, the difference is hospice is more for the end-of-life phase of care. Generally when the medical community feels that based on the disease trajectory and the things that have happened or currently going on, limited treatment options or poor response to therapies. If a patient's life expectancy may be 6 months or less, that's totally a hospice appropriate referral or need. And it's not just for the end of life as far as the dying phase, it's for the more acute symptom management needs that are likely needed during that last estimated 6 months of life. Whereas palliative medicine, we prefer to think of that as from the time of any chronic diagnosis, meaning CHF, COPD, not just, and cancers of course included, HIV, AIDS, all of those chronic diseases that mean there's going to be a lot of changes over the course of that disease, and that could be weeks, months, years even. And so palliative care does not require it to dictate or mandate that this is an end-of-life need, but it's a lifelong road of understanding, education, medication adjustment, symptom management, all that improve quality of life, as well as hospice goal is for quality of life at end of life. The palliative model is more for the trajectory, for the long haul, and that's from the time of diagnosis throughout the disease course, not just in the final or later stages of the disease.
I see.
Yeah.
how does or how do medical professions know how or when to involve palliative care into their patient's plan?
Ideally, in a clinical or outpatient setting, I strongly believe that when patients are seen in the clinical setting, if the physicians are looking at one or two diagnoses that both are considered chronic. I mean, for example, some people that have COPD also have CHF. Both may be well managed, but the two together over time can sort of exacerbate the other because those two systems are very connected. And so that's an appropriate patient, even when they're doing well, to begin the conversations about their symptom management, some anticipatory things that they may see, diet management, but also talking about who decision makers are, who's their support system, who understands what their current disease stage is and what their challenges are starting to be. Because usually when we're seeing patients more frequently, it's because the symptoms related to one or more of their, we call it comorbidities or multiple disease processes, those things can kind of at some point collide. And so we want to make sure that early management is definitely a part of it, but the conversation about anticipatory things and how to respond to the early indicators so that we don't have the later delay in care or management.
It goes without saying, I guess, that palliative care discussions can be difficult conversations.
Absolutely.
So how do you overcome that or confront that?
Okay. Well, as a palliative care provider myself, a lot of the tools that are out there. For the medical community, it's very important that we gain a certain comfort level with understanding challenges and more the social dynamics that go along with the medical clinical picture of what patients and families are going through. As diseases advance, sometimes people don't have the finances or the insurance coverage or other things that create barriers to their care management. And it's understanding and understanding the big picture and some of those challenges and meeting those head on. But then finding the proper support so that we feel educated as the medical community with dealing with these more difficult conversations. Again, not always talking necessarily end of life, but there are times when we have to tell our patients and families that something is not working the way we would have liked for it to. Sometimes lifestyle changes or habits can be complicating the medical tolerance or medical management. And there are times we have to address those things too. So it's, again, seeking resources that help us from a medical standpoint, the medical community, feel comfortable with those more complicated conversations, knowing our own personal stance, and then respecting the freedom of everyone to have their thoughts and feelings, and then respecting or validating that, and then finding that middle ground to come to a common place where we can make sure we're providing the best care possible with all factors included. So it may mean pulling in social work and other departments in a hospital setting, in a clinic. I don't know what the makeup may be of the clinics, but sometimes it may be appropriate to seek other medical professionals from a social standpoint to help build that plan or that need for that family. So it just depends, very, very tailored to what patients need as individuals at that point. So I think that's big.
And who are the important people that you would include in these discussions?
Oh, another good one. I sometimes run into situations with patients, and generally you tend to think, oh, the husband and wife, these two are the decision makers. And as the conversations evolve, the wife or husband may say, oh, but I also want my brother or another person, my best friend, someone else included, especially when you're talking about health surrogate, meaning if someone had to help make medical decisions or make decisions on the behalf of the patient, we don't want them, when it's possible, to only get pulled in on that latter phase when the patient is not able to participate in their care management. We want them involved along the way so that as the care plan needs, what have you, change, they're an active part of that so that the patient's wishes are known and that we as a medical community, we can bring those together. I always tell my patients, you know mama, we know medicine. This is where we come together because it's very much an important thing to have the patient and family, surrogate, whoever, involved and to feel like they're the drivers. We are all passengers. They're pulling us all in for support, but ultimately they're the drivers, and we want them to feel empowered to be making medical decisions.
So their inner circle, basically, like everyone has their
Everybody
nearest
has
and
their-
dearest group. And
Everybody has their inner
why not
circle.
bring all of them in that sort of discussion,
Right.
because they are going to be some of their best support.
Absolutely.
And that is where they're going to get the love
Absolutely.
that they need to drive them through this.
Absolutely.
So that inner
Absolutely.
circle is important.
The inner circle is important, and it can be a sub-circle, because sometimes when you have too many people involved, then there's folks who may have their own opinion, and it supersedes for them what the patient's needs and wishes. And sometimes we have to remind everybody, remember, you're here on behalf of this person, your loved one, your friend, and this is what you're here to help us know what they would want us to know if they were able to answer these questions. So that's very difficult if it's done later down the road versus earlier on when we are actively looking at treating and adjusting medications a lot sooner on the front end, so that the back end, nobody has to really play catch up versus knowing what the course has been and then being able and prepared to jump in when needed. Yeah.
I took the liberty of pulling up the community Palliative Consultants
Sure.
website as we were talking. I want to show it to you real quick just before I give out this website and the phone number to make sure it's the right one.
Absolutely.
But if anyone watching today has more questions and they want to find out more information about this, there's a phone number that you can call to find out more info, and that number is 904-407-7700. If you type in Community Palliative Care Consultants, Jacksonville, Florida, it'll bring the website right up on Google. But I'll also put all the contact information below.
That will work.
Jayla, I want to thank you so much for doing this today.
Not a problem. Thank you so much.
Big help to everyone who comes across it. If people do have questions, would I be able to reach out to you later to get those answered?
Absolutely. Please do.
Awesome.
I welcome it.
Well, thanks again. I'm going to turn the camera around real quick. Hey everybody, we've got some more videos coming up your way. If you guys have suggestions on different experts in this community, in this field, that you would like to see as part of our patient support videos, please leave them in the comments below. I'm always interested in what you're interested in. So thank you all so much for tuning in, and until next time, I'll see y'all later.